Why do we use Accurx? So, well, it's a no-brainer. It's fast, it's efficient, and it's free. It's three things that we very rarely get in the pharmacy world. And I can guarantee you, once you try it, you won't go back. It's sort of like the WhatsApp for pharmacies, but smarter and way more useful. We use it in our pharmacy because it works. It makes communication better between the pharmacy and GP surgeries. It's quick, it's clear, it's efficient, and it's professional, it's traceable, and keeps everything in one place. There's no more sort of, as Liv said earlier, no more waiting on hold. There's no lost emails. There's no verbally passing on messages through the patient or through the receptionists and messages getting misconstrued. It really is incredible. Sending messages directly to the practice, you're attaching documents, you're asking clinical questions, and then you get replies back. Again, everything that is traceable and secure and saved in the patient record. It saves time, it reduces frustration, and it most importantly improves patient care. So that's why we use it really. And it definitely it fits very, very well within our day-to-day workflow in a very busy pharmacy. So why wouldn't you use it?
Wow, thank you. And would you mind just going into some of the details of how exactly you do use it, and if you've got any kind of tips and tricks or templates that you found worked particularly well for you?
Yeah. So in our pharmacy, say we receive a pharmacy first referral from a general practice, we'd automatically see which ones would fit into the 7 clinical pathway. If they would fit into the 7 clinical pathway, we would send them a questionnaire, one of the Accurx clinical questionnaires that's on there, so that I can then wait for a response back and wait for and deal with the minor illness pharmacy first referrals that we receive, or any other services that we're doing, any other advanced, enhanced, or private services that we're doing, or if the ACT isn't in, checking off prescriptions. It's helpful for patients who are at work, so they can't answer the call and they need to, sort of send a message back and tell me when it's available for me to call them. And same again for patients and parents when their kids, are sort of at school and, they sort of need to wait for their kid is back to sort of send a photo or arrange a mutually convenient time after school time. Um, we also use it to attach the ABPM leaflets and the healthy living leaflets to patients in our blood pressure consultations. So instead of printing off papers, they've always got it there on their phone or a web link, and it doesn't go anywhere. So they've always got access to it. So we also meet our spec as well. We also send exercises using the BSOL Better You app. We sort of send that sort of hyperlink as well to patients for those with muscle and joint issues. In our pharmacy contraception service, it's brilliant, and our umbrella sexual health service, because we can attach the missed pill guidance. So if they forget anything that we've told them, it's all there. They don't have to sort of, if they want to call back up their pharmacy, they can, but sometimes the pharmacy line can be quite engaged. We also, most importantly, send safety netting leaflets, for example, for fevers for children who are under 5 or over 5, so that the parents aren't sort of clogging up NHS 111. It's got a nice sort of a traffic light grid on it, red straight to A&E, amber and sort of, where to go, whether that's general practice or community pharmacy, and green sort of home things they can do at home to sort of look at. So that's great. We also use it in the pharmacy first sore throat clinical pathway as well, to sort of send photos back of their tonsils. And a bonus is, you're saving the environment. You don't have to print any papers. And most importantly, sort of message GP, communicating back with the GP. It's really, really helped, even with the practice we've been working quite closely with. They love it because, we can attach sort of I know they'll receive the consultation back through GP Connect, through their EMIS or the System 1 system. But if we needed to write a quick note that the patient needs to be seen same day because maybe they've got acute pyelonephritis and they need to be seen same day, or if there's any sort of communicating any MSNs, any out of stocks, any alternatives available, and any clinical queries sort of with patients, with sort of doses or instructions that you would normally see, which quite clearly is hospital type instructions, and you just want that clarification, and you get that back. I absolutely love it because you can tailor make your templates for each scenario that you generally faced, in your community pharmacy as well. Yeah, it's brilliant.
Wow, thank you. And I think you've touched on it quite a few benefits that you've seen there. But if you could summarize what the biggest impact you think is for you and for your patients, that would be really helpful.
I think for me and the patients, we love listening to that music tone, don't we? When we ring up the GP surgery. But sort of being on hold for 10 minutes, patient or pharmacist, we could be dancing around the dispensary, but we wouldn't be. Too much to do. Just sort of, being able to message back that GP practice directly, so there's no miscommunication, there's an audit trail, and you can clearly communicate with that doctor or a member of that GP practice.
Perfect, thank you. And what would your advice be if there's anyone on the call today who hasn't yet got started?
I'd say it's genuinely a game changer. It's free, as Nike's logo says, and hashtag just do it. Honestly, you'll thank everyone for it.
Yes, so my name's Gov. I've kind of got a mixture of experience. Predominantly now it's within general practice. Just finished as a common role as the engagement lead within the area to support the uptake of advanced services within sort of the community pharmacy. As part of that role, I've been pushing for the use of Accurx, predominantly what Liv has gone through in terms of the reasonings why. The concerns I had when I was trying to promote pharmacy first, for example, from general practice, was there appeared to be a lack of communication between general practice and pharmacies of patients who were ineligible for treatment under pharmacy first, and it was causing some resistance for further sorts of referrals to community pharmacies. As a result of that, I implemented a plan where pharmacies would use Accurx to send urgent emails to the relevant general practice of the clinical reasons to why patients can't be treated under the pharmacy first. And this supports the admin team in reception to put those clinical reasonings on the appointment tab on Call GP. So it allows the completion really of the appropriate appointment in a more timely fashion. A big one, as Liv mentioned, that out of stocks. I think it's really important because I don't know whether everyone's aware. Unfortunately, there was an incident last year where so someone unfortunately passed away because of situations of out of stock. So the GPHC did look into sort of the out of stock processing protocol of the pharmacy. So as Liv mentioned there, the use of Accurx has that sort of robust audit trail. I can contest when I work in general practice, the alerts we get back from emails, they are sort of looked at quite regularly as well. So that's really important. And I think the complaints I had within all the resistance I had in general practice was similar to what Liv said. We would tend to get notifications from pharmacies of medication out of stock, but no notification of alternatives. It was more or less notified to the practice when patients had already run out. So utilising Accurx for that is really important. I think I can contest to, because I tend to action majority of these in general practice, and what we find is it's really difficult to get in touch with pharmacies. Understandably, pharmacies are very busy, therefore it's causing clinicians such as myself having to contact other pharmacies to obtain alternatives, where we eliminate that sort of process, or we eliminate that complexity of that task really. Going to sort of the advanced services, and Olivia kind of showed on the slide there, with the hypertension case finding service, the ambulatory monitoring, it's really important for pharmacies to obtain full consent with administering ambulatory blood monitoring. It's quite a lot of information to go through, and within the Black Country now, general practices can refer patients electronically to pharmacies. So it can be very difficult for pharmacies to manage those referrals. So what I would advise pharmacies to do when I was doing my engagement role was, when you obtain those electronic referrals, use Accurx, book patients in at less busy times throughout the day for that relevant service. If it's ambulatory, attach the leaflet to it so it allows the consultation when the patient does arrive to be more robust, and it allows it to be more clinically orientated of answering any questions they may have after reading the leaflet. Not many patients really know the process of ambulatory monitoring. Also with clinical blood pressure as well, there's a lot of factors where patients need to avoid. So for example, if they're taking any medication that can cause fluctuation of blood pressure, it's really important as good practice for patients to not have a blood pressure measured on full stomach or full bladder. That can cause fluctuations in blood pressure. So you can create your own template to advise patients to avoid certain parameters to ensure the clinical blood pressure is correct. I know that Liv mentioned there, as part of what we do in general practice, is any consultations regarding infections is really important. Target leaflets are sent to patients. If you go on the website, there are many different languages that those can be downloaded. So any consultations, whether antibiotics have been given or not, those should be sent to patients so we can demonstrate community pharmacy are delivering a service similar to that within general practice. Similar to contraception service, the concern I had within one of my general practices was, is the service similar within pharmacies compared to in general practice? So you can utilize Accurx to send information on perinatal advice, smear screening, that's really important as well. The big one I'm looking back at my days in community pharmacy, and what I would utilize Accurx as well is you get a lot of MHRA alerts. So if patients have had certain batches of medication dispensed to them, you can use Accurx to notify those patients, and then they can attend the pharmacy to return those affected batches, and it shows a more robust audit within your pharmacies and how you're managing those MHRA alerts as well, which is really important. Similar with the two-way conversation with patients as well, which is really important to allow patients to respond. The last aspect which I would utilise, and again I'm thinking about my days when I used to work in community pharmacy, was whenever I used to see prescriptions and I had a clinical query, now you have that facility of sending that, and because it goes directly to the GP, because they can see that email on their Accurx tab, they can answer that. So that's a really important tool to use as well. I've had multiple times when I will go to check a prescription and I've noticed an interaction. Instead of having to contact reception, etc., we can then sort of email the practices directly. So as Liv said, it's so diverse, and this is sort of tipping sort of the surface really on how you can utilize it. Develop your own templates, and you can demonstrate good practice measures to really support your patients using Accurx. But yeah, those are sort of my experience, and I use it so much in general practice. So there's many aspects that you can sort of use it really.
Thank you, Gov. And just to really quickly touch on, where do you think it's had the biggest impact, and then what would your advice be to anyone on this call who's maybe not yet got started?
What I would do is I would utilize it I would download it, use it for some basic sorts of implementations first. So for example, Olivia said, you could use it for notifying patients that prescriptions have been attended. It'll be really good to use it to book patients in on less quieter periods of time when you get those referrals, now that you're going to get them electronically from general practices or even from NHS 111. Use it for some basic items first and then expand the usage of it. So what I would do is download it, trial it out on a few patients on those sorts of basic usages, and then once you get to grips with the system, you can get everyone on board in your teams, and then you can start utilizing it much more for other sort of aspects. So that's what I would advise. Yeah.
Fab, thank you, Gov. and Suk, over to you to introduce yourself, please, and just give a brief introduction as to why and how you use Accurx.
Hi everyone, I'm Suk. I'm a contractor in the Black Country of the pharmacy, and we've been using Accurx now for coming up to, I'd say, about 2 years of using it. How do we use it in the pharmacy? It's similar to what Govinda was saying as well. There's a lot of out of stocks. Effectively, it's become our default way of communicating with surgeries we work with. We're in a health centre, so we work very collaboratively with the surgery next door. But Accurx has become the default way of training anybody. This is how you're going to now communicate with your other healthcare professionals. And the primary reason for that is the usage is very simple and nice and easy to use. And secondly, that it's already known to be used and is, second nature to all those who work in a general practice. So we're not trying to, reinvent the wheel here. We're using an already well-trodden path. So it's very, very simple to contact other healthcare professionals. What do? We do out of stocks. We also and then it's kind of completing the circle as well. I think it's a great tool in order to communicate with others, but often a problem in the past had been that we'd communicate with each other as healthcare professionals, but maybe leave the patient out of it. So this allows us to both communicate with the other healthcare professional and also keep the patient in the loop, because the biggest form of frustration we'd found over many, many decades would be the patient just didn't know where they stood, what's happening. So at least with this form of communication, going to smartphones or emails, it's very, very simple to use. Also, we're using it and finding a great use for it now as the pharmacy role is expanding, and getting the best use of pharmacists and the pharmacy team is that when somebody in the GP surgery is about to perform a task now, and they might think, oh, I could actually send this to the pharmacy, because it's integrated within their whichever system they're using. They could just send an Accurx message straight away to the pharmacy to say, rather than me doing this contraception, why don't you do it? It'll free me up to do other work. So it's a very easy way for them just to send those across. And another way I'm trying to think of what other ways I think that haven't been discussed yet is, for example, with consultations on Pharmacy First as they're coming through. Now, it might well be that the consultation has been done and all the records have been completed, and it lands in GP Connect and it's ready for the GP to look at. However, we use Accurx quite a lot in this instance, because it might be that no one's really looking at GP Connect also and won't look until the end of the day. Whereas if something needs to be actioned, we'd both do the consultation and send a note to the GP as well saying, hi, please can you have a look at this because X, Y, and Z has come up. And that's been a great way of using it in order to contact GP colleagues to say, look, can we help us out? Can we move on and get this patient helped? So yeah, it's been really good. It's very easy to use. So I'd say if anybody is not downloaded or not started using it yet, as I was saying, play around with it and work out templates. That we set up lots of templates. A lot of things before the out of stock thing was available. We had separate templates for each item that was out of stock, and then also this will prevent a lot of damage in the future, because you can actually tell your colleagues what's out of stock, and then you can also put in the suitable alternative, and that can then be done. So you're not having to send this every month to the surgery. They might just amend it because it might be that stock isn't going to come back in, or it might be discontinued, etc. But yeah, it's a very good service. It's the only thing I would say, and I always have to put something in there, is that at the moment everything comes through email. Now in GP land and elsewhere, it's all integrated. Whereas on the pharmacy side, yes, we are having to open up emails, look at emails, and get these things across. If there could be some form of integrated tool, it would be so much easier. But at the moment, that's just picking around the edges, to be honest. But it's a great service, and I think there's a lot of positives to use it more.